Welcome. Welcome to HIP, Health Insurance Personalized. Health Insurance Personalized. What is it? It entails. A lot of you have questions. How can you personalize health insurance? Let me clarify certain issues here. A lot of people seem to misunderstand what is healthcare and what is health insurance. Healthcare is once you receive the care, either from a doctor or from the hospital, that is health care. Once you receive the care at any facility or by any healthcare professional, that is healthcare. Then what is health insurance? Health insurance is how you pay for the care. This is what it is. This is the insurance concept originated from Baylor. Believe me, in 1930s, Baylor came up with an idea because hospital revenue kept dwindling and people could not afford to pay the bills of the hospital. Baylor came up with a plan to have a monthly payment to cover for the hospital stay. Believe it or not, those days in 1930s, during the Depression era, the payment was 50 cents, folks, 50 cents for the hospital coverage. Even today, if you raise it by 1,000% inflation, it only comes to $7. This is how the Blue Cross came about. Then Blue Shield was formed in 1939 to pay for the physician bills. So Blue Shield and Blue Cross came into the vogue to take care of the people in regard to the health care. And what it started as a simple concept that mushroomed into an insurance industry, so-called insurance. So you pay monthly dues, you get the coverage for the hospital, you get coverage for the physician payments. Then you also have to have a drug plan, all those things. So personalized healthcare covers the entire hospital, physicians, you name it, and including the drugs. Right now what we see is healthcare is too complicated, folks. They make it deliberately confusing. It is simple. It is simple. If you receive the care, that's healthcare. If you have to pay, how you pay for it, that is health insurance. So there is no doubt we all need insurance coverage for the health care. But how you finance the insurance payment, that is the bottom line. When I say personalized health care, it is really personalized. It is catered to the individual needs, folks. It is individual needs. The consumer, whatever he wants. It's like any other insurance. Like, if you have an auto insurance, you have a home insurance, you get the coverage for what you need. This is what it is all about, personalized health care. Personalized health care, if a person is healthy, if he is physically fit, he doesn't see the doctor, he comes into a well category. And 63% of the Americans are in well category. Their premiums, I'm telling you, their premium should not be more than $150. Their premium should be a lot lower. It is a deductible premium, but it should not be over $150 a month for an individual. For a family, it should be around $600. It should be more than $600, but it's not. It is not. I will get to the point how you can personalize healthcare. So let's go into detail what this personalized health insurance is not. I want to clarify these things, folks. I want to make sure you understand. When I'm talking about personalized health insurance, it is only for health care. Personalized health insurance does not include short-term disability. It does not include fixed indemnity. It does not include even a limited benefit or credit insurance coverage for a supplemental liability insurance. And it does not cover the workman's comp policy. It does not include, and it also does not include the automobile medical payment insurance. I want to clarify this. It is not an automobile accidental coverage. It does not include insurance under which benefits are payable with or without regard to fault, and which is statutorily required to be contained in a liability insurance policy, or equivalent to self-insurance. So what it is, personalized health insurance is basically based on the personal health care needs, and the initial payments are made from the personal care accounts. When you buy a coverage, health insurance coverage, for an individual, if you say $150 a month, but there is a deductible component up to certain amount, up to certain amount, you have to pay. You're responsible for the certain amount initially, but after that, the insurance takes care of the major medical coverage part. That's where the insurance. So initially, the reason why there is a deductible component, because a lot of people abuse the insurance. Whenever somebody has a free care, whenever there is, it's a government mandated care, they abuse the system, folks. They abuse the system. So to discourage a person from abusing this healthcare delivery, initially, person has to be responsible. He has to be responsible. He has to take care of his health. He has to be physically fit. If the person, we have an issue. We have an issue in this country. Obesity is a major problem. Obesity. A lot of folks tend to ignore the fact it is all on your personal choices, folks. And mental health is a major problem in our culture. How do we address the mental health? It all depends on personal responsibility in taking care of, I understand when the people get depressed, they end up having wrong food and end up being a couch potato, and they end up gaining weight. But if you're personally responsible, if you take care of your health, you also make good usage of your personal health in savings, health savings, so-called health savings. That's how the health saving concept came about. What the government has to do is to provide the tools for people who can't get the health care. They have to provide that's where the public-private partnership comes in, folks. Most of the time, what I'm saying is most of the large companies, you're talking about over 100 million large employer groups, have their own self-insurance. They are self-funded. They're not covered by the insurance folks. They are self-funded by private companies. But when it comes to the small mom and pop, that is a bread and butter of our country. When it comes to politicians tend to ignore small mom and pop businesses. We need to provide and facilitate how you can get health coverage for these small business communities, folks. Right now with COVID, restaurants are facing enormous pressure, especially if in New York, all the small businesses are hurting because they have been shut down almost for a year. There has to be a way we can, this is where the government comes in, folks. You need to help rather than mandating, shutting them down. You need to encourage the private businesses to prosper. You cannot punish, individuals in general. Americans are responsible. You need to give them the tools what they need. So let me come back to this personalized, so-called personalized health insurance. What it is, who are these main stakeholders? Who are the main stakeholders? A lot of people ask it, who are the stakeholders in this personalized health insurance? It's simple, folks. First, you as a consumer, you are the number one stakeholder in the personalized health insurance because you have a personal risk. This is an asset, folks. Health is an asset. I don't know why people can't get to it. Health is an asset. You need to protect yourself. You need to insure yourself. You cannot, I understand people can't afford to pay the health. This is where certificate of guaranteed coverage comes in. Government, not the government, public-private partnership has to give a certificate of guaranteed coverage for all Americans, irrespective of their economic status. We don't want bronze and gold and platinum. What is this? It's a class system. We don't like that. Let's have a uniform for people that are economically impaired or physically impaired. Give them the certificate of guaranteed coverage to all Americans, people who can't afford it. That is our responsibility as a society. This is where the public-private partnership comes. It's a bright, even a lot of Democrats believe in public. I don't see why Democrats cannot embrace public-private partnership. Chicago Mayor Rahm Emanuel, he did a wonderful job through public-private partnerships. We can do the same thing in healthcare, folks. We can. It is just a matter of, it's a matter of choice we make. We cannot have, in healthcare, you can't have one-size-fits-all approach. It doesn't work. Healthcare, you cannot have one-size-fits-all approach. Medicare for all, I have no problem with Medicare for all, but it has to be reformed. What we have Medicare today, it was originally, intent was in 1960s by Lyndon Johnson administration for seniors who were laid off, who were done with their regular work, and when they get to retire, they had no health coverage. That's how they came with the Medicare. It's a beautiful concept, folks. But if you want to expand the Medicare, do it in the right way. Right now, Medicare is antiquated, folks. Antiquated. You know what we have? I'll tell you. Medicare, what we have, has a basic coverage. That's all there is to it. That's why we have a problem with Medicare. Medicare doesn't cover a lot of folks. That's where we have Medicare Advantage. What Medicare is doing is pumping the money into the private companies. We need to stop that. We need to give the power back to the people, folks. Let people choose what they want. Let them have the choices to make. So this is where the consumers are the number one. Consumer. This whole thing of personal healthcare is consumer driven healthcare. Demand control healthcare. Consumers demand the affordability, demand transparency, demand competition. Right now, healthcare is going in the wrong direction, folks. It is going the wrong direction. The reason I say that, these companies, hospital mergers, group mergers, is stifling the competition. That is not the right thing. We need more competition, not less time. We need more transparency. We need more transparency. This is where consumers have a right to demand for affordability, right to demand transparency, right to demand competition, and right to receive the care. Consumers have to have they have to have a freedom to choose. If I'm sick, I want the best care for myself. I'm not going to, go where somebody tells me to go. I want to make a choice. This is an American dream, folks. We want freedom. We want freedom in healthcare. I can't re-emphasize the fact the only way it can be done if consumers are in the drive. Consumers have been ignored all these years. I'm telling you, consumers have been ignored. Let's put the consumers in the. Consumers are smart enough to take care. Give them the personal responsibility. If a person is healthy, they save money. They save on expenditure. So that's the consumer is the number one stakeholder. Who is the next big stakeholder? Are the uninsured people. We have, the way the Obamacare came in 2009, 2010 under President Obama. He did the right thing. He wanted to take care of the people who are uninsured. That's how we were able to get the Obama. But Obamacare did not address the issue. It is all premium based. It didn't have the flexibility of healthcare delivery. It is all premium based coverage. And one size fits all, government from top down, it doesn't work. It doesn't work. You have to have consumers in the driver's seat, folks. I bet you most of the Democrats want the choice of a doctor, choice of the facility. We all want. So when you have so many uninsured Americans, there is a reason why we have so many uninsured. The reason why is some people choose not to buy the insurance. People who don't want to buy the health insurance, instead of mandating them, take away their exemptions. Take away the exemptions for the individual and the family. When they lose the exemption, they end up paying more taxes. That encourages them to have insurance. Rather than mandating from top down, just get rid of the exemptions if the people don't buy health insurance. That is the best way to handle the situation. When people deliberately, a lot of people don't buy the health insurance, but there are consequences for not having insurance. And what it is, focus on the small businesses, folks. We have never focused on small businesses. We need to focus on that. Is the majority of these 28 million work for small businesses like mom and pop, grocery stores, you name it, restaurants. They are the bread and butter. That's the engine of America. We need to take care of those folks. So second, stakeholders are uninsured. Give them the guaranteed access to affordable coverage. You have to. This is where the government, it is for the people and by the people. As Kennedy said, government has to help them, give them the tools. They're not asking for a handout, they're asking for health coverage. It can be done. It can be done. The uninsured are the the second major stakeholders. I'm including the uninsured because that's a major factor we are having issues. That is why the premiums are raising for the rest of the folks, because our insurance premiums are not segmented. It is rising. Healthcare costs is because of the folks who are uninsured ending up in the hospital. Hospitals bills, hospitals can't take care of these folks automatically, so they keep raising the healthcare costs to make the revenue so that they can survive. So one thing leads to the other, folks. So uninsured is also a stakeholder. We can't ignore that. That is a major issue. And number three, who are the stakeholders? Hospitals. We need to minimize the uncompensated. This is where I was telling you about uncompensated care. When hospital provides the there's a law. If I'm uninsured, if I end up in the emergency room, they have to provide the care. And even though it costs several thousands of dollars, you can bill them. Basically, the hospitals can't make up that cost. They have to recoup that money. To recoup the money, they go to the private insurance companies and bill it more. So that's what happened to when I ended up in a hospital for a simple 23-hour stay in the hospital for an angioplasty. Hospital sent me a bill. I'm not kidding, folks. This is what brought me into this healthcare. I'm passionate about healthcare because when I stayed in the hospital 23 hours, 10 days later, I received a bill for $227,000, folks. I'm not kidding. I received a bill for $227,000, not even a day in the hospital. And recently I came across a pregnant woman. It doesn't matter, normal delivery or C-section. She got a bill for $650,000. How about that? Beauty. This is hospitals is a major stakeholder. We need to deregulate the hospital industry, folks. The more regulations you pass, hospitals are being choked with the regulations. It costs. The cost goes up. When you choke with too many regulations, the bed cost goes up. Hospital bed, and on the top of it, uncompensated care. Hospitals are losing money because by law they have to provide the care. So we need to minimize the uncompensated care. With personalized health care, yes. With a certificate of guaranteed coverage to these folks who go to the hospital, that will minimize the uncompensated care. Who is the next major stakeholder? Obviously, healthcare professionals, doctors. There are issues. Doctors need a tort reform. Most of the doctors in the United States, they practice defensive medicine. The reason is they want to protect their pocketbook, folks. They cannot be sued if they don't order the chest x-ray or if they don't do a CAT scan. They get sued because that is, and again, tort reform is such, you limit the damages. Anytime there's a malpractice case, there has to be limit. You cannot go by emotion. I would like to see healthcare professionals get involved in the jury rather than ordinary. We cannot play emotions in healthcare, folks. Healthcare professionals deal with day in and day out. They are the perfect jury for healthcare malpractice lawsuits. And that will lessen the defensive medicine. I used to order, every time I took the patient to the hospital for surgeries, everybody gets a chest x-ray, which is unnecessary. Everybody gets to, and if you go to the emergency room, if you complain of a simple headache, they have to do a CAT scan. There is a thing called clinical medicine, folks. It is simple. You don't need a CAT scan just because somebody has a headache. That's crazy. This is all defensive. If the hospitals don't do that, they get sued. Something happens to that patient, they get sued. So the tort reform has to be enforced even for especially for the hospitals and doctors, so they can practice less defensive medicine. It's very important. These are the major stakeholders, folks. Doctors, yes. Then who's next? Well, insurers, so-called insurance companies. Right now, insurers are the one controlling the healthcare, folks. Insurers, insurance companies have a major stake in the legislation. They have the lobbies like nobody else does. They have the lobby. They don't want consumers to be in the driver's seat. They don't like consumers. If the consumers are in the driver's seat, it is tough for them because consumers demand affordable premiums, and consumers demand segmentation. If I belong to a well category, I should be based on well category. If I belong to an at-risk category or acute condition, if you're a smoker, druggie, you name it, if hypertensive, I'm at risk. My premiums have to be based among the group of at risk. And if I have chronic illnesses, the other issue is chronic illness is the major component of the healthcare expense. Only 15% of the Americans have chronic illness, but their claims are 48%, folks. 48. This is where our cost. We can lower the cost by focusing on the 15%. We can lower, and we can focus on acute illnesses. We can lower the premium by giving smoke cessation classes, by discouraging them to use drugs, by discouraging them to use alcohol. Everything has a benefit, and encouraging to lose weight, have a modest, healthy diet so we can lose weight. Those simple, they need to be rewarded for their good behavior, folks. We are not doing that. We are not rewarding the consumers for their good behavior. Right now, there's nothing. In healthcare, there's no incentives at all. I can be 400, 500 pounds. What they have, as long as somebody's taking care of me, I don't have any personal responsibility. It's very important in healthcare, folks. You need have a personal responsibility. This country is good when it comes to retail, shopping. But when you talk about healthcare, I don't know what happens. Even in groceries, they've done well. Look at Amazon, look at Google, what they've done. Why can't we do it in healthcare? We can, as long as we modify. If Medicare, they want to modernize it and you want to give it to everybody, but it has to be consumer driven. It has to be. It cannot be top down government, one payer system. It can't be. It's not feasible. You cannot have one size fits all. You really need to modernize 1960 basic coverage. Right now, the way I see it, if I have a Medicare, if I didn't have the supplemental, every time I get hospitalized, I have to pay $1,400. After 60 days, I end up paying $352 per day. After 90 days, $752 per day up to 90. And a lot of folks can't afford it. How do we modify that? First of all, hospitals don't get paid by the days, folks. They get paid by the DRG, diagnostic related. It doesn't matter how long they stay. It is up to the hospital for them to get better and discharge them as soon. There is a DRG code. Hospitals have gotten smarter. People who are outliers, they make big bucks on the outliers, on the DRGs. But we can get rid of this hospital copays. That's why a lot of folks go and buy Medicare Advantage or supplement. Even supplemental is not needed, folks. If you give that same money, what you're giving it to the mid-level companies like Medicare Advantage, give that money back to the consumers. They can take care of themselves. It is possible. These hospital copays and physician copays, 20%. Every time you see a doctor, you're responsible for 20%. It is not necessary. If you have a personal care accounts, if you have a personal savings accounts, those things and we need to expand that basic coverage. What we have in Medicare, we need to expand. The Part A is for the hospital, Part B for the doctors, Part C is not needed. We don't need a Medicare Advantage. Medicare Advantage came in because a lot of folks just can't afford to pay the co-insurance, co-pays. Actually, if you invest this money, what you're giving it to the Medicare recipient, they can have their own personal health savings accounts. They would love to save money. Senior folks would love to save that money into their personal care accounts. And it is their money, believe me. And now what Medicare, if Department of HHS is listening, you're pumping the money into the wrong hands, folks. You need to give that money to the senior folks so they can take care of them and they can set up their own personal care accounts, personal health savings accounts. That's what we need. We need to expand Medicare. So we don't need Part A, B, C, D, C, Joe. And it is blue, bronze plan, gold plan, platinum. Come on, folks, let's not do that. Why are we creating the class system? California, covered California, it has a bronze plan, gold plan, platinum. We are creating this class system, folks. It's not acceptable. It is not necessary to create. Give the power back to the consumers, folks. That's what it is. So insurers have been the spoilers all this time. Give the control back to the consumers. I would like to see to stabilize the private insurance market, expand the client sales and the product offerings to the consumers. But you need to stabilize the private insurance market, folks. There's no doubt. We have to stabilize private insurance market. Who are next? Employers. Employers provide the best self-funded health insurance under the ERISA, under the federal law. They have the best coverage because employers knows how to get the coverage, how to get the maximum usage of self-funded plan, folks. These are employer subsidized coverages. They are the best. I think the Medicare should look into that, try to complement what they have under the employer subsidized coverage. Government should have the same, almost the same. Last but not the least are the agents and brokers. Agents and brokers. So those are the stakeholders too, agents and brokers. We can look at how the agents and brokers charge the commission. We can look at that and how we can address that, but it can be done. If you have agents or brokers, people who cannot take care of themselves, these agents and brokers will do a good job, because nowadays with technology, you can people can learn how to handle their own personal care accounts. You have advisors, so-called healthcare advisors. They will be able to handle. We have financial experts. Same thing. When seniors, when they get to retirement age, there are financial advisors everywhere. Why can't we have healthcare advisors to manage their personal care accounts? That will induce the seniors to save money. Everybody wants to save and they want to be empowered. Consumers want to be in control. That's what we need to do, folks. The beauty about healthcare we have been missing is total freedom and consumer empowered healthcare, folks. That's what it is. That's what I'm talking about, personalized health.